Okay, thank you very much. Before I go any further, I'm just going to flip a slide forward because they weren't working properly earlier. So can people see that it's moved on?
Yep.
Yeah, it's working. Oh, great. Thanks very much. Okay. So as Mark said, my name's Claire Bianacchi. I'm the programme lead for Dementia with Joined Up Care Derbyshire. I'm joined today by Phil and Lorraine, my colleagues. So the way it's going to work is we've got a few slides, not too many, but I'm just going to talk about dementia in the context of Derbyshire with a little bit of data. I'm going to chat through the national pathway, the Well Pathway for Dementia that we construct our services around. I'm going to talk a little bit about the targets that are set nationally that we have to achieve. Then I'm going to hand over to Phil, who's going to talk about the work we've done in engagement so far. Today is part of our engagement. We want to hear some of your views, want to hear the questions you've got and get some feedback from you. At the bottom of that slide there, it says your opinion matters. That's very true. Lorraine has then got a question for you just to stimulate some thoughts. And Phil's going to go through some of the achievements of our strategy, which has been running for the last 5 years. And then I'm going to round up with some of the challenges facing us as a dementia programme, but also facing the whole of Derbyshire, really, in terms of how we can improve things for people living with dementia. So straight on then with dementia in the context of Derby and Derbyshire. According to NHS England, there's just under 15,000 people living with dementia in Derbyshire. There's an asterisk there because there's other organisations and population watchers that disagree and say that figure is higher. But that's the one we work with in the NHS and social care across our services in Derbyshire. The significant factors are that there's been a 30% increase in that population of people living with dementia since 2013. And it's projected to keep rising until 2030 and possibly beyond because we have got an ageing society. And that's significant because the older you are, the more susceptible you are to developing dementia. So an ageing society is going to have a lot more people living with dementia than a younger population. So of significance as well, and this is particular, these figures are particular to Derbyshire and Derby, 58% of the people living with dementia will have severe dementia. And again, that's important in terms of individuals' outcomes, obviously, and carers, but also in terms of the type of services that we have. Because, of course, if your dementia is more advanced or severe, you will likely need more of those services. A national figure this time, 92% of people living with dementia will have at least one comorbid condition. So they'll be living with at least one other ill health condition. And for 17% of those people, they will have more than 6 other conditions. So it's people living with dementia, perhaps heart failure, diabetes, frailty, at least 6 conditions. And again, that's, has significant impacts for people's quality of life, but also the type and range and amount of services that people need. So I mentioned previously that there's a pathway for services. Again, this is an NHS pathway. It's called the Well Pathway for Dementia. And they ask us to have services related to preventing or reducing the risk of developing dementia, a diagnosis service, so people are diagnosed accurately and in a timely manner, that we have services for people to access when they need high quality care and health response, and that people can live well with dementia so that they can access all the activities and social outlets that people who don't have dementia access, and that they would have support to do that. And finally, that people with dementia have the opportunity to die well, to die with dignity and in a place of their choosing. So when we're constructing our strategy, those are the sections that we think about to try and ensure we have good quality and enough services so that people can experience that. So we have some key national targets and some guidance about how we deliver and manage services. The first and probably the foremost NHS national target is that 67%, 2/3 of people with dementia are actually diagnosed. And the asterisk there indicates for me to tell you all that in Derbyshire we achieved that last year. In fact, pre-COVID we were at about 70%, but during the pandemic, in common with every other area in the country, the diagnosis rate slipped. We went down to 62%, but over the last year we've regained, and at the moment, actually hot off the press this morning, we're 63%. We do have significant challenges in that area because we know we've got hundreds of people waiting for their assessment and to be diagnosed. And they're waiting a long time. They're waiting nearly 6 months at the moment. So that's a significant area that we need to improve on. However, we are better than most parts of the country, a lot of parts of the country. And in fact, NHS England have asked us to speak to other local systems about how we achieve that, because they're down around between maybe 60 and 62%. Other targets we have are to improve our risk reduction awareness raising, and we'll have a big concentration on that in the new strategy. More people living in care homes should be diagnosed. Again, we've done some work that Phil will refer to in a few minutes around that. 70% of people in care homes are predicted to have dementia, and certainly not even half of them are diagnosed. So another target is around increasing the number of people with advanced care plans so that their wishes for care in the future are known, that people are supported to go home from hospital without delay. We've got big issues. 50%, people with dementia stay 50% longer in hospital than people who don't have dementia. We've got a specific problem in Derbyshire and Derby that we don't have enough care home places, and we have fewer care home places than some of the areas like Nottinghamshire near us. So that's an issue. People in caring roles should be supported. That's a target. And as is the care being joined up and accessible. Reduction in variation of services. I'm just reading through these at the moment, so I'm not going to do that because you can see them. So I'm handing over to Phil.
Hi everyone. So my name's Phil Wall, and I'm a commissioner at Derbyshire County Council in our adult care department. And I work quite closely with Claire and Lorraine, who works in our public health department at the County Council. So I'm just going to talk to you a little bit about how we've engaged with people the last few months. Back in April, we launched a survey asking people what they thought our priorities should be going forward in terms of dementia care and support. So dementia care and support is very broad. There's a number of elements to it, as Claire's already mentioned. So we had 193 people respond to the survey, and 80 of those were people living with dementia and other carers, and then 113 of those were professionals, people that work with people with dementia. And we got a spread of uptake from across the county and Derby City, which we were pleased with. There's been a number of consultations running at a similar time to this engagement, which may have affected that result. I think we had a few more people last time we did an engagement for the strategy, but we're pleased overall with the uptake. Okay, next slide, please. Okay, so we've analysed the survey results and looked at the kind of key themes that came out of the engagement, and then we had a follow-up event at the Post Mill in South Normanton 2 or 3 weeks ago now, and we had some people with dementia and their carers attend, as well as a number of professionals, where we sort of discussed what we'd had so far, but gave the opportunity to talk about the new strategy and priorities. Some of the things that have come out of the survey, we just tried to sum up, and I've shared some quotes here on the screen. So one of the big things that came out of the engagement were the carer voice, and the fact that informal carers do so much for their loved ones with dementia and continue to need recognition, support in their own right. So respite and breaks which give you the confidence your loved one is still being cared for well with respect and dignity. That was something that someone said as part of the engagement. People told us that things like memory marketplaces, where organisations get together in one place, are really helpful. One of the quotes we've included was the fact that it's challenging when you have to tell your story numerous times to health and care services. That's something we're trying to rule out, but still does happen. So greater awareness of dementia and the way it affects daily routines across all services being important. And then ascertaining early on what difficulties they're experiencing and if they require formal support or the care requires support. And then the other one that I've included, raise awareness of the risks that cause dementia. So in the last year or two, we've had a bit of a push on brain health and the concept of brain health and risk reduction and people's awareness of potentially getting dementia and what they can do about that. And we'll talk more about that shortly. So just moving on to the next slide. So when we did the last strategy, which ran from 2020 to 25, we asked about a number of priority areas, and we took the same approach with the engagement this time. So we asked about 8 priorities that were included in the last strategy. We asked people to prioritize them in order and have a think about whether there's anything we're missing as well, any gaps. So these are all reasonably high level, but some of the ones mentioned on the screen are around staff working in health and social care, having the right information, knowledge and skills around dementia, improving access to and quality of treatment and support following diagnosis, and delivering services that diagnose in a timely manner. That's something that Claire's alluded to earlier. Ensuring more people with dementia have an advanced plan of care, so that describes their wishes for the future. Ensuring care for people living with dementia is well coordinated and integrated. That's something that we're all trying to do constantly in Joined Up Care Derbyshire, work more collaboratively and knit services together better. Tailor services to meet the needs of different and diverse community groups. So we have a range of community groups with different needs, and we need to get better at ensuring our services are accessible to all. Continue to build communities where dementia is understood and people living with dementia included, respected and supported. And then the other one, ensure people of Derbyshire have information about dementia and aware of ways in which they can minimise their risk of developing dementia. So that's the whole brain health thing that I mentioned a few minutes ago. Because that's become such a big priority in the last year or two for us, and we've had an event and various things around that, we thought we'd ask a question about it. So just moving on to the next slide and then passing over to Lorraine from Public Health.
Thanks, Phil. So hi everybody, I'm Lorraine Stokes and I work at Derbyshire County Council in the public health team there. So in our team in public health, we're trying to help people to stay healthy, protect people from threats to their health. And part of what I've really been focusing on is around the preventing well part of the pathway that Claire mentioned. So around helping people to reduce their risk of developing dementia, and that's one of our Derbyshire strategic priorities as well. So what we thought is we'd take the opportunity today to be able to try and make it a little bit more interactive and ask you to find out what you know about dementia risk reduction. So this question is actually a little bit outdated now. There's actually been 14 risk factors that are found to potentially increase the risk of developing dementia. And that these what we call modifiable risk factors. So they're the factors that we have the ability as individuals or as a society to change. They're the things that we can try and do something about. And it's actually 45% of dementia around the world could be reduced by addressing these. So we wanted to throw it out there to see if you're able to, and I can see some coming in already, think what these 14 risk factors might be. So I'm just going to give it a minute or so just to let people have a little think and be able to go onto Slido or onto the chat to be able to put in what they think they might be. So we've got lots coming through. That's really great. And definitely a lot of those are the risk factors that have been identified. So whilst they're coming through, I'm just going to give you a little bit more information about the risk reduction work and the kind of key messages that we're trying to get out there. So researchers have calculated that if as a society and individuals we could completely address 14 health and lifestyle factors, it could prevent or delay nearly half, so 45% of dementia cases around the world. So we're not saying that this is a surefire prevention, it's just about trying to shift the odds more in your favour around, committing to those healthy lifestyle factors. So there's some key messages that we try and get out around what's good for your heart is also good for your head. Particularly in Derby and Derbyshire, we have a high diagnosis of vascular dementia, and a lot of the risk factors for kind of coronary heart disease is also linked to vascular dementia as well. So those healthy lifestyle factors are certainly really important there. Dementia isn't an inevitable part of getting older. That's a key message that we want to be able to get out to the public, and that it's never too early or too late to start thinking about your brain health. So we talk about some simple rules for people to be able to remember and try and follow. So that's around looking after your heart health, staying social and keeping mentally active. And by doing that, you'll be able to do all you can to help, support your incredible brain to be able to operate the best that it can for as long as possible. There's a really great Think Brain Health check-in that the Alzheimer's Research UK have been doing a big campaign over at the moment. So what I'm going to do is I'm going to pop a link to that in the chat, along with what the 14 risk factors are. I can quickly read through them now, but I appreciate you kind of having a lot of information, so you might want to have a look at that later on and absorb some of that. And some of the things we can do to reduce our risk and also help us to live well with dementia. So I'll quickly read through now what those are, because I can see that a lot of them have been covered in what's come up. So according to The Lancet, very recently, I think it was the beginning of August, they have released the 14 risk factors, and these are less education, hearing loss, high cholesterol, depression, traumatic brain injury, physical inactivity, diabetes, smoking, hypertension, obesity, excessive alcohol, social isolation, air pollution, and visual loss. So it's the visual loss and high cholesterol, which are the two new ones that have been added this year. I'm also going to pop in a link to the Live Laugh Better Derbyshire and Live Well services for Derbyshire and Derby City, which are able to support with some of those risk factors around tackling obesity, smoking cessation, and physical activity, if anybody's interested themselves or wants to pass that information along to friends and family. But yep, I'll leave that there, and I'm going to hand back over to Phil, and hopefully that's given you a very brief whistle-stop tour to our Preventing Well part of the pathway.
Thanks, Lorraine. So yeah, just a little bit more on what we've achieved in the last 5 years. So getting you to think about some of the things that we've collaborated on to date, and then maybe where we can collaborate further as well, because I'm sure you've all got your ideas. So in the last 5 years, we've got obviously Joined Up Care Derbyshire, which is a system-wide approach to things like dementia. We've now got a dementia website on Joined Up Care Derbyshire. We've also got a very resource-laden dementia website for the dementia support services. So Derby City and Derbyshire County Council both commission dementia support services provided by the Alzheimer's Society. They're kind of our flagship information and advice services, and there's a lot of really useful information around living with dementia, caring for someone with dementia on those sites. More referrals responded to than ever. So yeah, we continue to see more people with dementia or their carers. So that's the council, that's the voluntary sector that we commissioned to provide support, that's the NHS. I think in the last year, our dementia support service in Derbyshire increased their referrals by about 30%. So we are seeing more people, which is good, and we're getting to people earlier and having the conversation earlier, which is really important. We've now got more dementia nurses across the acute hospitals and primary care. We've got Admiral nurses working in parts of Derbyshire, which are making a real difference. Diagnosis rates are above the national average. I think Claire mentioned earlier, we've still got a way to go with that. That's a continuous thing that we are measured on, but also that we're battling with. Pathways to a diagnosis have been extended. dementia palliative care service established. One of the biggest things that came out of our last engagement period before we wrote a strategy 5 years ago was that we didn't have an awful lot of support for people at the end of life, receiving maybe palliative care. So we used that engagement to kind of look at what we could do more of, and launched a palliative care service that Derbyshire Healthcare Foundation Trust provide. We did a bit of learning from other regions about what they do, and we've now got a really important and successful palliative care service that works across Derbyshire and is well respected. So, you know, it was really useful with the last engagement to learn that we didn't have anything at the dying well stage of the dementia pathway, and do something and fight for resource to do more. And we've got more people with an advanced care plan as a result, and more people on the palliative care register. We've also achieved some national, above a national average for diagnosis of people under 65. We've got more of a focus on younger people with dementia than we've ever had before. We've just had a very successful pilot led by the Alzheimer's Society in Derbyshire that's identified a number of people of working age with dementia, and we're looking at how to support those people maybe differently to other people, because their needs are different, and the support they require might be different. And we've done some really good work in that field that we're continuing to do. We've now got a specialist younger person worker in the Alzheimer's Society service in Derbyshire. We've now got a rare dementias working group, which is quite exciting for us. We're starting to have conversations, including with people with lived experience around different dementias that we know less about in Derbyshire, and educating people who work with them. We've had an event around brain health, which is what Lorraine's just been talking about, and risk reduction. So we're more aware of that and creating more awareness in Derbyshire around that, which we think is important. And also, we've hosted a Dementia Hearing Health event to highlight the links between hearing loss and dementia, because we've seen that that's an important risk factor, and we have a very useful connection between our hearing health support service and our dementia support service. So we've done things, we're collaborating, but there's more we can do, and we want your ideas about that. I guess that's part of why we're here today. We're just moving on, I think, to you, Claire.
Yeah, thanks very much, Phil. We're coming towards the end of the slides, really, but just wanted to summarise the challenges that we face as a pathway provider, but also as part of the Derbyshire population, really. We have got an increasing population. Lorraine's given you some information about lifestyle factors that impact your susceptibility to dementia, and really our population has got pockets of great depravity, really, where that population is much more susceptible to developing dementia. So that's a concern. The level of comorbidity, I think, you know, we've known for a long time that we've got an aging population. More people are getting to big ages. Into your 80s now is, you know, not as unusual as it used to be, but we're not necessarily aging healthily. We're aging with and bringing a lot of health conditions along with us as we go. So how we manage and treat and care for people who've got more than 3-4 things wrong with them is a significant challenge, not just for the dementia pathway, but for all of us, really. We've become very specialised in treating different illnesses, so that when somebody comes along with 3 or 4 or 5 things, they get treated by 3 or 4 or 5 specialists. And we need to get a lot better at treating the whole person, rather than just concentrating on you know, the thing that we know about. So that issue I referred to earlier about low and reducing care home places, during the pandemic, care homes closed. 17% of care home beds nationally closed. They've not recovered, they've not come back. And again, in Derby and Derbyshire, we do have a specific problem related to the number of care home beds available and registered for people with dementia. And in comparison with some of our close neighbours, we're we're very poorly off, really. And it does mean that people with dementia have to stay longer in hospital. And that's not really acceptable. But it's how do we get over that challenge? We've also got a bit of an odd challenge in that there are new dementia treatments likely to be introduced within the next year or so. We've got disease-modifying treatments, and that means that these treatments are, they'll slow the progression of early dementia, not a cure, but they're quite difficult to implement because there's lots of brain scans and intravenous infusions that are involved. So that's going to be a challenge in getting that up and running and getting these treatments to people at the right stage of their dementia. Again, a couple of us have alluded to the waits for diagnosis. It's not acceptable that people have to wait 6 months to find out whether or not they've got dementia. The main difficulty there in terms of how we overcome that, the main service we've got, the Memory Assessment Service, has done some absolutely fantastic work. And only for the work that they've done, we'd be in a much worse position. And the bottom line is that service hasn't seen any investment since it was set up 10 years ago. So how we get any further with that without some new investment, which we all know is going to be extremely difficult, it's difficult to know. I've put rise in acuity. Basically, that means during the pandemic, because of the absence of services, because of the pandemic, a lot of people with dementia got a lot worse more quickly than they would have done if those services had been in place. So there's a lot of people living with very complex and multiple issues related to their dementia, and coping with that in all our care services is quite difficult, and supporting carers at home and people to live well is quite a challenge. The financial constraints, we might have a different government, but I don't think any of us who work in health and care are expecting any rainbows or anything at the end of any rainbows in terms of additional funding. We will keep advocating for that, I can assure you, because we are desperate. Another challenge will be recruiting staff, training staff, and keeping those staff, because all of the services we need will need staff to run them. So that's more or less the slides that we've got, but we have got another Slido just to bring things to an end and to start the Q&A, really. This one is about having listened to what we've said, but also with your own thoughts and experiences in terms of dementia. What do you think are the issues that we should be concentrating on in the next 5 years? So really, this Slido is just an introduction. Over to you. What can you think, or what would you like to add to what we've had to say? And we're all happy to take questions. Obviously, I'll leave that up for a couple of minutes so we can gather your thoughts. And as I'm leaving that up, I can't see if anybody has got any questions. So if somebody'd like to shout out. I can see Richard Smith has a hand up.
I have, yeah. Going back to hearing, I mean, I've been using the NHS hearing service for a very long time, and I'm just amazed how easy it is to get it done. A certain well-known hearing company, won't name it, have been most helpful. I mean, I walked in there on the first day, had a hearing test, and came out with hearing aids within 45 minutes. And I didn't need a letter from a doctor. I didn't need anything. I can't. Is this number of people getting worse? I mean, industry is going downhill. You know, the mines have closed, the heavy industry where people were deafened at work. I would have thought the situation was improving and not getting worse. Can't quite see why. I can understand that if people can't hear conversation, they become...
You've put your finger on it, Richard. You've put your finger on it.
they become isolated very
Exactly.
quickly. As I became isolated, I was in a total mess. I
Yeah.
have to say that I lost contact with an awful lot of people.
Richard, you're describing exactly why it's important for people to know that your hearing health plays a part in your likelihood or your risk of developing dementia. So those things you've described, we're not criticising the hearing services, they're brilliant, and you're quite right.
You're right.
What we're saying is we're trying to raise awareness amongst people that if you're not hearing as well as you used to, you might be inclined to isolate yourself, not pay attention to people and withdraw. And that may lead you to having difficulties in relation to developing dementia. So thank you for raising that. That's great.
Yes. And of course, I use technology to get around this problem. So I tend to text people rather than speak to people.
That sounds great.
A slightly lazy way of doing it, but I can still hold a conversation with my kids in Canada that I couldn't probably do any other way.
Well, thank you very much. I think we've got another hand up, Richard, if I can interrupt you briefly.
You can.
Thank you for that. I can see there's a hand up, but I can't see who it is.
I can just see Richard's hand up at the moment. And let me just say for a second that I believe Mark, who was helping facilitate, got called out on there was a fire evacuation in our Derby office. So I think he may be able to hear, but he's I think he's outside the building trying to log on. So perhaps if are there any other hands that are going to go up now? If anyone wants to, then I thought we might just jump to the questions on some of the comments and questions on Slido.
Lee, you're very quiet, so I'm
Yeah,
not sure
very
everyone can
faint.
hear you. Have you got your headset to your mouth? That's better.
Sorry, let me come onto camera. You knew exactly what was going on there. I didn't. Yeah. Okay. I can see a comment from Julian in the chat about concern about making space losing the contract for support in Derby City, and how will that impact on support services? I don't know if that's one we could pick up.
Yeah, I'm happy to if you want, Claire.
Go for it.
So Derby City have retendered their dementia support service, and Alzheimer's Society are now the provider. Because Alzheimer's Society also provide the Derbyshire service that Derbyshire County Council and the ICB Commission, we think that's hopefully good news in terms of more synergy, more collaboration between the services. And there's been a reasonable transition and mitigations put in. We're trying to, I think Derby City Commissioners are working closely with Alzheimer's Society around the new service and trying to involve people in kind of designing that where they can and making sure we're not losing people. So hopefully they are covering the ground they need to, and we're all ears if they're not. Please do let us know. I just want to go back to take the opportunity to quickly just go back to something Claire mentioned in the presentation as well about care homes and that being a challenge in terms of care home places. Our particular challenge is nursing care homes and specialist dementia placements in nursing homes. That's not specific to Derbyshire. That's an issue, I think, across the country, across the care sector. So we do have some challenges there, but our market position statements that we produce very much talk around nursing being an area where we're trying to attract more developers to build specialist nursing homes. As we see more people with dementia, inevitably we're seeing more complex dementia care and people who require those kind of placements. So I hope that answers that.
Excellent. Thank you very much. Now I'm just going back to the chat box at the moment, just to see if we can clear any comments coming up through there. So Carol, I know your hand was up and then it went down, and you're asking about what about the increase in vapes? Is that related to dementia? Just give a second for Carol to come in. I think you're on mute there, Carol. I don't know if you could put a bit more information about the questions in the chat box. Does that ring any bells, Claire? Anything along that sort of?
I think it's a valid query, because I think if you imagine that smoking is correlated with a higher risk of dementia, then maybe at some point vaping will be. There's nothing at the moment. There's absolutely nothing in the research, but I think that's probably a reflection of there hasn't been any research rather than anything else. So I certainly think it's a valid point to raise, but at the moment we just don't know.
Okay,
just
excellent.
to come in on that, Claire, yeah, just to reiterate that there's not been any evidence that's come out to say that there's any concerns around vaping and linked to brain health at the moment. We know that there are successful quitting aid for smoking, and that smoking cessation is one of the key risk factors, that there is evidence of an association there. So I think kind of our focus in regards to risk reduction is around supporting people to quit smoking and access their local services in Derbyshire County and Derby City. So Live Life Better Derbyshire and Live Well Derby.
Excellent, thank you. And then I can see
Lee,
Dave. Yep.
Sorry. No, I was just going to pick up on, I just literally saw Jane's comment in the chat about lack of funding for the service that she's involved in providing. And really, I just wanted to pick up on funding in general, because we do know, we keep hearing, we hear on the news, we hear everywhere we go really about reduction in funding, and it has really, really impacted the dementia pathway and the types of resources we have to enable people with dementia to have a better life, and particularly carers. And it is one of the fundamental worries we have at the moment, particularly on the back of the pandemic and going forward, how we can create better services, respite in particular for carers of people living with dementia, and for the people themselves, opportunities to go to. But unfortunately, all we can see at the moment is the challenges around the financial envelope. For the first time ever, and I've worked in the NHS a lot longer than I would probably admit publicly, this is the first 12 months that I've known where there was no funding at all to even bid for in terms of the services we have in dementia, because we've run some really good pilot services, particularly just thinking about into primary care, into GP surgeries over the last year. And usually when you run a really good pilot service with really positive outcomes, you can scrabble together a bit of money to keep them going. We haven't even been able to do that this year. So I feel for you, Jane, and I'm sure we would love to use that service, and we'd love to be in a position to provide the funding for that. But it is, at the moment, it's dire. The only bit of optimism I have to add to that, and I think Phil and Lorraine have backed me up, is we have discovered within the partnership, the Dementia Partnership that supports the dementia programme, we've got about 30 different organisations and service providers who now work better together than they ever have before, through necessity, really. And we have found that we can make some good positive changes through that. But as I was saying before about the memory assessment service, no new funding since it was set up 10 years ago. You know, it is a dire situation. So I can only apologise, Jane. If I could scrabble the money together, we'd be doing a lot better.
Thank you, Claire. And thanks for picking up comments in the chat, Phil, and answering those queries that look like they're individual queries and just helping now.
That's fine. I know Dave from old, so I'm happy to talk about that with you, Dave. I'll email you.
If
Does anybody else have any final questions? Sorry about that, Lee. Do you have a question, Lee?
No, we've had a power cut, so please take over.
It's all going to pot today, isn't it?
It has indeed. I'm safe from my fire evacuation. Thank you, everybody. Okay, I'll take over. So, are there any final questions before we start to bring this to a close?
I can see a hand up. Is it Kay? Have you got your hand up,
Hey,
Kay?
Kay Bagley. Kay, would you like to ask your question?
Can you hear me?
Yes.
Oh, good. I'm sorry, I'm traveling in the car. I'm a passenger, so I might cut in and out a little bit. I think I put a question on there about bringing dementia education to rural communities. Did you get that?
I can't see it in the chat, Kay, but I can imagine the question is, why aren't we better at doing that?
No, actually,
Oh.
just to say that I'm a volunteer information champion, and we go to our community to find out suggestions of what they'd like to hear about regarding health, social and well-being information. And one of those was around dementia and how to keep your brain healthy. So a couple of volunteers in the village of Hartington, we've got together with the health professionals in Derby and Derbyshire and public health and volunteers, and we're looking to put a session on to no cost to the NHS, to join with those professionals to bring this information to our community, to look at, you know, dementia awareness, the contraindication, the risk factors, to look at how we can manage those in a rural community. Because I think, you know, we found that we don't always get equal opportunities and access to services because they go to priority areas, and we're quite keen on making sure that we do have these accesses, because when you see plans, rural communities, social isolation's just flagged up, but there's a lot more that rural communities want to hear about. So I just wanted to share that with you guys. So at the moment, we're just waiting on
I think Kay may have dipped out, but that sounds fantastic. Sounds like a really good initiative.
I think she has dipped out. Okay, we'll start to bring it to a close. First of all, I want everybody to know that if you do have any other questions after this session, then contact details are on the end of the presentation. So please feel free to email anybody directly or me, and I'll be able to pass on any queries anyway. So I'm bringing it to a close. Oh, I think she was back and has gone again. Okay, in bringing it to a close, I'd like to thank very much our presenters today, Claire Berniacki, Phil Wall and Lorraine Stokes. This was a great presentation. I personally have a vested interest because my mother might be on a dementia journey, so it was really of interest to me as well. I'd also like to thank the BSL interpreters for their time, Emma Walker and Helen Blunden. And of course, all our guests for turning up today, for your contribution to the discussion. I'd like you all to look forward to the next Derbyshire Dialogue, which is improving pain management. And that's going to be on the 11th of September. Invites for that session will be sent out today or tomorrow, whenever we've uploaded this particular session. And I'd like everybody here to please start spreading the word. Let's get more people onto Derbyshire Dialogue as well. So thank you very much for your time, everybody. And Lee, please feel free to stop the recording. Thank you, everyone. Bye-bye.
Thank you.